Our next speaker comes from the Lead Home Visiting Program, is Belen Coronado. She's a health educator at the Salt Lake County Health Department, and she has developed and implemented the Lead Education Home Visiting Program. And I just wanted to add this because I find it very happy. But in her spare time, she competes in Latin dancing and has won first place in a worldwide competition and will represent Utah again in the world's salsa competition in January. And now we would have had time for her team to come and dance for us, which was one of our things we wanted to do, but instead she's going to talk to us.
Thank you, Claudia, for the lovely introduction. If you want more information about my dancing, talk to me afterwards. But yeah, so a little bit shorter. So as Claudia mentioned, my name is Belen Coronado, and I work at the Salt Lake County Health Department. And I am here to just talk about this new service that we have at the Health Department, which is a Lead Education Home Visiting Program. Can you all hear me well? And my role has been to develop the curriculum for these home visits with the help of others, such as the other home visiting programs like the asthma home visiting program, and then also with the help of the staff from the Lead Safe Housing program, which you all will be learning about in a little bit. Susan Fox, and she's going to be presenting about that. She's been really helpful in the development of this curriculum. So thank you. And the goal for this program, this home visits, is to provide education. So to provide education for the families who have children with elevated blood lead levels, as well as to look at the lead sources. So find possible sources of lead in the home and outside the home and their environment. And then lastly, to provide resources for these families. So the one that we really encourage is the Lead Safe Housing program, which if they do qualify, someone from that program comes with as a joint visit, home visit. And then other resources like the Head Start program and the Baby Watch Early Intervention program. And then other health department services like the WIC services, because we also do focus on nutrition, and that's a great resource for those families. So being in people's homes, it just gives us an opportunity to really get to know the families and know their health needs. So it's a great opportunity to really get that one-on-one interaction with them. So for this program, to be eligible to this home visits, the families do have to have, the child who does have to have a confirmed elevated blood lead level through a venous draw. Okay, so they will have it if they have above 5, and a health educator, myself, will go into the home, and if they have 5 until 19.9. And if they have above 20, then a staff member from the epidemiology department at the Salt Lake County and the environmental health goes out and does like a run through their homes and also look at lead sources. And our target is children under 6, but we do see some refugees, so it might vary in age for those refugees. A week ago or 2 weeks ago, I went to a home and they had children, and they were refugees, and some of them were 14 or 15 years old. So the caseload for us, it is a new program, and we just started implementing these home visits. And in 2018, there were 30 children total, but take in consideration that in some homes, there is more than one child in the home with elevated blood lead levels. So a total of 10 families in 2018 that had this. And then in 2019 so far, as we do more screenings, it will increase, but so far has been 37 children with elevated blood lead levels with a total of 19 families. And so far we've reached 13 children, and majority have been with home visits, but if for whatever reason they can't do a home visit or anything or they refuse, we can provide the education over the phone, some of the education, and then send the materials that we would use in the home visits to them so they can get access to them as well. So a little bit of an overview. So I go into the homes and we really try to accommodate to the languages and to their needs. So I provide the services in Spanish and English and all of the materials translated as well. But if they are, for example, like refugees, then we do have interpretation services over the phone and in person for those families. So when we go, it's about an hour to an hour and a half. It really just depends on the family and if they have more questions, or it's really like centered to their needs. So we go in, and it's a health educator, myself, with a staff member from another program, like the Let's Safe Housing program or another program that we work with. So you all will be getting these slides. I don't think you can read all of the kind of like the details about the program, but I'll give you an overview. So when we do receive the confirmed venous draw, like elevated blood levels, then a public health nurse from our epidemiology department at the Salt Lake County does go ahead and calls the clinics, and she's actually here, Becky. She calls the clinics and get more demographics from these families, like, for example, the language, and verifies some of the addresses and things like that. So once I get that information, then I do an intake call, which is a cold call, really. Some of the families, like if the clinic knows that this program is available, then they'll know. But this is a great opportunity for you all that you're going to be testing it in clinics to know that if there is a confirmed venous draw, elevated blood level of above 5, then you can let them know that someone from the health department is going to be calling them to set up these home visits. And I forgot to mention, but all of these services are free. And then that's really important for me to tell them when I do this intake call for the families, that everything is going to be free, and we just want to help them to better understand the levels in their child for lead. And then, so yeah, the intake call first, like just collecting some more demographics to know if they're eligible for the Lead Safe Housing program, and just schedule the actual home visit. And then in the actual home visit, then first of all, I start with the assessment. So doing a lead knowledge assessment, I do like a pre and post. So this just allows me to really know like where they're at, and I really want to meet them in the middle, like where they're at, and that guides that conversation, because it is really one-on-one. So I also like look at the sources, any possible sources that they know, like what's around in the child's environment, and then like the child's behavior. We talk about, so that in actually doing the education. So we go about and do the lead basics. We talk about that, as well as what symptoms they might have, the child, if any, and what the parent can do to help the child. So we talk a lot about cleaning, proper hand washing, as well as nutrition, and helping them help the child to be able to absorb less of lead if it is in their environment. And then talking about the child's development. So we do encourage reading to the children, and we actually have this program that they get to sign a pledge to read to them every day, and we got books donated, thanks to Randy, that we provide to the families, and they really like that aspect because it's something that they're doing to help the children, and we encourage reading all the time. As well, we do provide some incentives, so $15 Walmart gift card. Who doesn't want that? So this in the hopes that it can help them with like cleaning supplies or like any nutrition items that they might need. And then lastly, we do look at doing like an action plan, so creating some goals, specifically some SMART goals. We kind of get trained. I've been trained in motivational interviewing, so we use that to really encourage them to to be active in the to helping the children with elevated blood levels. And then after the home visit, then usually we encourage them to get tested, and we talk about retesting for lead and follow up between 3 months to 4 months, depending if they have a retest appointment with their physicians. So yeah, we do just follow up and look at sources. We talk about the goals and what they're doing, behavioral changes that they've done, and then re-emphasize the resources. So here are just some examples of what we use, the materials that we use. We have like this flip chart that I use to educate the families, and really just making it simple and as straightforward as that can be. It is a lot of information to cover in like an hour or an hour and a half, so really trying to make it easy for them to visualize this and making that one-on-one interaction really focused. And because it is a lot of information, we do provide a packet, like kind of like a folder with some of the key items that we talk about, like nutrition and cleaning, things like that, and the resources, so they can have that with them afterwards. So here is a slide that we talk to them about. We really encourage the families, the parents, to talk to their physicians about the elevated blood levels and have kind of like an action plan with them. So the first thing that we do tell them, as you can read here, is when does my child need to be retested for lead, to make sure that the levels are going down, hopefully, once we do identified sources and helping them with the cleaning and nutrition, all of those things. And then symptoms, if any, or if they need any other tests, like some of the children have had low iron, if they do need to some supplemental supplements to their nutrition. So this last one, I really wanted to end with kind of like an open-ended question for you all as healthcare providers, that what is it that you need from me, or what would be like a good type of feedback or information that would be helpful for you as a healthcare provider to know about these visits once they are done. So here is a little template that I've gathered from the asthma home visiting program at the Salt Lake County Health Department, and they're really good at having that bi-directional feedback. So some ideas would be like, if just like the information about the home visit when it was completed, possible lead sources, incentives that were given, and then goals, if this is something that's helpful. So I just leave that out to you all to think about it, and I will be here the rest of the day. So please approach me and kind of, starting that. Right now it's really kind of centered to the parents. So I do provide them with like kind of like a personal assessment, like to look at sources, and then any child behaviors that they see are different, or that they can really track and see, or any nutrition changes or supplements that they have, as well as the goals. But this is kind of like a little thing that I would like to more interaction with the clinics and the healthcare providers. So I would like to know what is helpful, and if everything included in this is good to have as a provider. Okay, so there is the general email right there, the lead prevention, but all of you have the folders. My personal email is in there. My name again is Belen Coronado, and I will leave this up here so you all can have that. That's the number, my direct number as well. So that is all that I have. So if you have any questions or want to chat with me about this, or have any ideas, as I mentioned, like I'm always like open to new ideas and things to better this program, and just to help the families and the children with elevated blood levels. So yeah, thank you.